Turning now to Sudan and a warning that our next story contains distressing details of sexual violence. The UN's Children's Agency, Unicef, has released a harrowing report on such violence in Sudan's civil war. It says armed men are raping and sexually assaulting children, including infants. The report has compiled more than 200 cases over the last 14 months, but says the figures represent only a small fraction of incidents.
In Sudan, rights groups have long been warning of the widespread use of sexual violence as a weapon of war. Now, a UNICEF report details for the first time how young children, too, are being subjected to assault and rape. An adult survivor has shared what she witnessed while being held by armed men. After 9 p.m., someone would open the door carrying a whip. They would pick one of the girls and then take her to another room. I could hear that little girl crying and screaming. They were raping her. Every time it happened, the girl would come back covered in blood, just a young child, and they would only be released in the morning. Working with a limited database of cases compiled by local groups since the beginning of 2024, UNICEF found at least 16 survivors were under the age of 5, and 4 were 1-year-old infants. Nearly a third of all child victims were boys. Many of the victims were left with serious injuries.
I met with girls who told me that they had attempted to commit suicide. I met with girls who had been diagnosed with depression, with anxiety, with post-traumatic stress disorder by professionals in Sudan. And one of them had even had seizures that had been linked to that post-traumatic stress. Her body was in shock by what had happened to her.
And with the majority of hospitals and medical facilities destroyed in conflict areas, access to services remains difficult. Because of this, as well as the social stigma victims of sexual violence there face, UNICEF believes the real number of child victims is likely much higher.
Eva Hinds is UNICEF's Chief of Communications, and she joins me now from Port Sudan. Thank you so much for joining us to speak about this. A reminder to those who are just joining that we will be talking about distressing details of sexual violence. Could you just begin by please telling us a little bit more about UNICEF's findings?
Well, our latest report finds that 221 children have been raped. 16 of these children are under the age of 5, 4 under the age of 1. And these are both girls and boys. Around 66% of this caseload are girls, and then the rest are boys. These are cases from all corners of the country, from north to south, from east to west.
And how did you go about collecting this information? Can you tell us exactly who you were able to speak to?
Well, rape is very complicated in many ways. It's already very complicated for those who survived. So after something terrible like this happens, unfortunately, it doesn't end there. Often after that comes stigma, fear, retribution, sometimes pregnancy. Some of these survivors, they had suicidal thoughts. So a lot of really horrendous things that they are going through. And that also makes the reporting and data collecting very difficult. It means that it's really important to meet very discreetly. It means that we need to de-identify information. We have to obscure identities, and we really need to make sure that these children are protected at all times when we speak to them and when we collect the data.
And that means, too, then, that this may not even be the full picture, right? Does UNICEF have reason to believe that the numbers are much higher?
Yes, unfortunately, this is likely to be the tip of the iceberg. There are many survivors who are very concerned and worried, and that's why they don't come forward. And there's different reasons for this. They fear being stigmatized by the community. They fear being shunned by family, or retribution from the people who attacked them, or from others. And we also hear from the frontline workers that the survivors are more likely to come forward when there are services, when there's a chance to get medical support or psychosocial support, or then talk to someone. And unfortunately, in many places across Sudan, this is not available today.
So what needs to be done now? What needs to happen to stop men from carrying out sexual violence in war zones like this?
I think many things need to be happen, and I think the first thing is that the violence needs to end. All those who are fighting, they need to end it, and the parties need to respect their obligations according to the international human rights law and international humanitarian law. Children need to be protected. They can't be attacked, whether that's killing, maiming, or sexual violence. It needs to end. It also means that those who provide these services, they have to be able to cross conflict lines. They have to be able to get safely to those who need services, as well as those who need them, need to have them available everywhere. They need legal services, they need health services, they need safe spaces where they can go and talk about these things. Frontline workers need to be trained and equipped with the right skills so that they can provide these services.
Well, thank you so much for taking the time to speak with us today on DW. That's Eva Hinds, UNICEF's Chief of Communications in Port Sudan.